Perfect. Good morning, Wakefield, and welcome to our weekly update on COVID-19 in the town of Wakefield. We did take last Friday off for the Thanksgiving weekend, and hopefully you all had a safe and quiet and socially distanced Thanksgiving, although it doesn't seem like the country heeded that from the numbers that we're seeing. But I hope that you had some peaceful time with your family anyway. So just a little bit of an update before I turn it over to the experts. And if we could show the chart, please, Ryan. Thank you. This chart is available at mass.gov, and it comes out every Thursday afternoon, or most Thursday afternoon, around 6 o'clock. It's up, says 5 o'clock, but don't go on at 5. It's never on at 5. And if you check our chat function, that there's a link there that Jen was great to put up there for us anyway. But you can see that Wakefield is maintaining in the yellow area, which I think is great. Comparatively, it's not really anything to be overly joyed about because since November 4th, which is the first time they started this new items in the state, we've had over 211 cases in Wakefield, and you can see that we're up to 681 through December 1st. So that's quite an increase over the last month or so, which is not different than the rest of the country is seeing. And if you look way across in the right column that is colored with the reds and the yellows, it shows that we have a positivity rate of 4.17% over the last 14 days, which means 4% of those are getting tested are coming out as positive. Our positivity rate way back on November 4th was around 1.5%. So we are seeing, like the rest of the country, an increase in incidence of people testing positive. Again, we can't stress this enough. Wash your hands, watch your distance, wear a mask, avoid large groups. Avoid, going out too many times, limit your trips. All these things we need to do. We need to be smart as we wait for a vaccine that will be coming out in the next month, but distribution is going to take a little bit of time. So Ryan, can we show the map for 1 second, if you don't mind? Thank you. Right, so I'm gonna test Ryan's ability of geography here, okay? So if you look at the map, it does color communities, and whether it's colored correct or not, this is the state really isn't doing this. This is I'll give kudos to WCVB Channel 5 for putting this out. Wakefield is shown here in the yellow, and Ryan, can you find that in your cursor there? Can you find Wakefield? Let's see how good you are. Keep going north, 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 east, east. That's west, east. There you go. That is Wakefield. Okay, right there. It's in the yellow, and it matches the test that came across. Now, if you were to go a little bit north, there is a community that is shaped a lot like Wakefield. Keep going to the east. Stop. South, south, south. There you go. Stop right there. That is, unfortunately, Middleton. It is not Wakefield. You see that the towns are similarly shaped. So if you look at this map, and if you're like me, you don't have your glasses on and you're watching TV when this comes on, I will tend to panic if I haven't seen it on my computer yet. Not that we should panic, because it's not a huge difference in incidences of cases. But so go by the chart, not necessarily the map. So I get calls and texts at my house from people. Steve, how do we go in the red? And I'm saying, no, you're looking at the wrong community. So that's enough for me to say today, but thank you for all of you that are working hard to stop the spread. Every single item, you can get rid of the maps now, Ryan. Every single item that we do as a community that reduces maybe one case, if we all did that, that really makes a huge difference. So don't think you're not making a difference by wearing your mask when you go around the lake or go for a walk, or making sure you wash your hands and you don't go into crowded places. You don't have a big amount of people over. So that's where we are. I'm going to turn it over to Ruth, who I'm sure has some interesting items for us.
Well, thanks, Steve. I appreciate that. not sure, interesting. Our updates, our cumulative total is over 700 cases at this point. We are absolutely in a surge. Again, not different from any other community. That doesn't make it right or good. But we are getting a lot of new cases every day, 20, over 20 sometimes in a day. So I can't emphasize enough about the social distancing. This virus is spread really person to person. If we could stay away from each other for a little while, it could really make a huge difference on our numbers. And my public service announcement for today is, please answer your phone even if you don't recognize the phone number, especially if you've been tested. Because if you tested positive, one of us is going to be calling you. We're not calling from town hall, we're calling from personal phones. You're not going to recognize the phone number. So it's really important that you pick up the phone, no matter what, unless it says New Zealand, pick up the phone. If it's a spam call, just hang up. But we're calling contacts, we're calling cases, and it's just really slowing things down, being able to contact people when they don't pick up the phone, which, again, I understand, but I'm just trying to get the message out. At this time, pick up the phone. The other thing we get questions about is the COVID vaccine distribution. Want to remind that the FDA has not approved the vaccines yet, or all of them yet. And the state's Public Health Council is meeting next Wednesday. It's a public meeting, so if you go on to mass.gov/DPH, you can find a link to their meeting. They are going to be discussing and hopefully approving an updated distribution plan for the state. The only thing I can say for certain is we are supposed to be getting the state will be getting vaccine this month. It will be going to healthcare providers who are on the front lines, those kinds of healthcare providers, and long-term care facilities. And we'll be getting the shipments not all at once, a little bit at a time. So once that cohort is fully vaccinated, which we are calling 1A, then 1B will start to get vaccinated. And I'm not going to say who's in 1B because that seems to be in flux. So I did say what was in it before, but that's what the Public Health Council is going to be talking about on Wednesday. But the general public, if you're a healthy, non-elderly person with no underlying health conditions, then you will not be getting immunized until the spring. And I'm not going to be more, and the dates are going to depend on how quickly the manufacturers can make the vaccine, and then how quickly it can get distributed and given to people, and then we move on to the next phase. But at this point, we're looking at spring. So stay tuned. We'll keep you posted, as I'm sure the regular news will be keeping us posted on the vaccine distribution when it arrives. And a reminder that the ones that are being approved right now are 2 doses, 2 weeks apart. So
Great. Thank you. Thank you very much, Ruth. Thank you. Tom Walsh, our Emergency Management Director.
Good morning.
Good morning.
Nothing really new on our end. We're just preparing and planning for what's going to come. Naturally, we just purchased a few tents for drive-through for vaccines. So we're in that mode. We're still awaiting what the guidance is from the state on what they're going to end up doing. Ruth, I had a question on that first wave of vaccines that are coming in. Are they being shipped directly to the facilities?
Yeah, they're being drop shipped to the hospitals. So the first vaccine comes in lots of 975 doses. So they're being shipped to the large hospitals that have the storage facilities, the super cold storage facilities for it. And the long-term care facilities, my understanding, all have contracts with either CVS or Walgreens. So it'll be shipped to the pharmacies who will be doing their vaccinations.
Thank you. The other thing is we're just awaiting the guidance from the state. Anything that's going to happen on our end really is going to be what the state ends up coming out and giving their orders from the governor. That's all I have.
Thank you, Tom. Thank you for all your hard work. I do see our superintendent of schools on there, Doug Lyons. How are you, Doug?
Good, Steve. Thank you very much. Good morning, everybody.
Much better than I am today.
Good morning, everybody.
I'm going to have to dress up next week.
Yeah.
I hope everybody's well. Just a quick update. We've gotten communications out in the last few days because there was a gap due to the Thanksgiving break, which I think we all needed. And so the update of our numbers is we have over a 2-week period. That's for the Friday that we were off after Thanksgiving, and up to this morning, we have 15 new cases that we're adding. That's student cases that we're adding to the data dashboard, which brings our total number of student cases to 40 at this point in time. And we're adding 6 staff members, which brings our total to 10 members at this point in time. Like you've heard from other members of this team, our numbers outside in the community are creeping up. And as they kind of creep up, we're also seeing a dramatic increase in the number of personnel, adults and students that are needing to quarantine, right? And so we have really 3 reasons that we're seeing that people are quarantining right now. One is because they have traveled and they want to thoughtfully follow the guidance from the governor's travel order, which requires that they quarantine. So they're quarantining for reasons that come under travel. The largest reason, the largest number of people that are quarantining are directed by either our local Board of Health or the Board of Health from which our staff members, the communities from which they come from. And the third reason that we're seeing a slight uptick in quarantining is parents that are quarantining their children just as a preventative measure or as a precautionary measure because there has been an exposure or because they have a family member that's ill. And we want to support that as well. We feel like that is a prudent decision that doesn't only help keep your children safe, but it also helps keep other children in school and faculty and staff safe as well. So that's what we're seeing. The number of people in district that we're seeing quarantine at this point this week is hovering around 70. We are anticipating that that's going to go up dramatically in the coming weeks. And that is, we're thinking we're paying close attention to how that affects us at the school level, right? And how that affects faculty and staff, because the more faculty and staff that need to quarantine, the more difficult it is for us to keep, especially our small schools, staffed and open. So at this point in time, it has not been a problem. And everyone has kind of pitched in at the school level to cover classes and do whatever they need to do to keep schools open and to keep our hybrid schedule moving forward. This past Monday, we welcomed back our high school faculty, staff, and students back into the hybrid schedule. They were off from the 16th, from the week of the 16th through Thanksgiving, where we scaled back schedules at the high school because we had a dramatic increase in the number of cases that really caused us to kind of think, what is the best way to keep all members safe, and in close communication and collaboration with our Board of Health and our school committee, we decided that it was best to just scale the high school back at that point in time. Currently, right now, we're looking very closely at an increase in our numbers at Doyle. And that's not our preschool students as much as it is our adults at Doyle. And Doyle is similar to Walton School and Greenwood in that they're small schools. You know, there's 10 classrooms at Doyle. There are 12 classrooms at Walton and 12 classrooms at Greenwood. And in our smaller sites, you know, when we have 3 personnel that are out or that need to be out either for COVID reasons or other reasons, it affects our ability to operate those sites. But right now we're paying particular attention to the Doyle because we have a few adults that are awaiting test results that might cause us to take other safety precautions as we have this past week. And so, and what we did at Doyle this past week is we scaled back, we closed the classroom and we are quarantining those students, right? Our little guys are at the preschool that are age 3 and 4. That's hands-on work as much as they're doing a fantastic job with their face coverings. They're still, you know, little guys, you know, and I was over there yesterday just kind of helping out and tied a few shoes and helped out a few people. And, you know, a few guys just came over. I must have looked like I needed a hug. So they gave me a hug and kept moving about their day. And so it's a reminder of what our work is like and how important it is right now to the community. So before I just sign off in my closing remarks, I'd just like to say a special thanks to the parents for ongoing support and to our nurses, faculty, and staff for really working hard to keep us all safe and to keep schools open. So thank you.
I'll jump in for a moment. Just want to echo what Doug said. Oh, I'm frozen.
Really keeping us safe. I do have our town council chair on, Ann Santos.
I froze for a moment.
Ann has shown exceptional leadership. We're so lucky to have her.
Oh, well, thank you. I feel lucky that we have the team that we do. Just echo thanking Doug, what the educators, administrators, and everyone else who works in the school system, as well as our first responders are doing. I don't have significant data, but I can echo what Ruth is saying, and you too, Doug. I've seen at the university level in Boston, a huge uptick in the amount of positive students in the last, I would say, 3 weeks. My students are early 20s and late 20s, but mid 20s. But we're seeing a lot of symptomatic too. And I think these are students who are trying to do their best. They were not out partying, they're law students, but they went home for Thanksgiving and then they've been testing positive. So I just would, you know, really ask everyone to be so careful. I think we see the vaccine in the future and people hopefully are not relaxing because before that vaccine hits, it just seems like the numbers are going to keep creeping up. So we are being vigilant and we would ask you all to be vigilant as well. Thank you.
Thank you, Ann. And we do have a member of our Board of Health who's also helping out in another role, contact tracing, I believe, right, Laurel? And thank you, Laurel.
When needed, as our team has been incredibly busy and they pull me when they need me. So I'll probably be doing some calls. So as Ruth says, I'm not going to tell you what my phone number is, but it always, when we do those calls, it's good to check in. And that's how we start a call is, you know, how are you? How are you doing? What are your questions? We clarify what isolation means and what quarantine means in a family and just make sure people are managing. And to echo what everybody else is saying, the team is doing a fabulous job. I think on the mental health side that we need to embrace some creative strategies for outreach and just some soul lifting. And so I've noticed some creative postings on social media about people being even more extraordinary with their lights for the winter season, kind of embracing our inner Scandinavian. And I just think, you know, as we're asking people to be super careful to use your phone and computers to reach out and make sure that you're connecting as well as just, thinking about people who might need a little connection, because we're missing those spontaneous moments where we just see people. So just watch out for each other and be kind.
Thank you. Thank you, Laurel. And we're trying to do a little bit of that at the town level. And maybe Jen can talk about a couple of campaigns we have going on, one of which is taking pictures and sharing that. So why don't you shoot on that one, Jen?
Sure. So the last time we had a call, I reviewed what we're calling the W's campaign. Wash your hands, wear a mask,
There you go. There you go.
watch your distance.
You froze.
Oh, Wakefield Pride. So you'll see banners going to be going up hopefully next week. There are signs in the kiosks and at the Civic Center. But the exciting component of that is that hopefully today our window decals are being delivered. And they're small. It's the kind of thing you would put maybe in your car next to your college, university, or sports team decal. You could put it on your office door, your storm door, or businesses can also put them in their glass doors. And all you need to do through the Wakefield Linfield Chamber of Commerce is either text, email, or post to Facebook and tag them, and you can enter to win restaurant gift certificates. And you'll be able to pick them up again, hopefully Monday. They should be coming today in the vestibule at Town Hall, next door at 5 Common Street, which is where the Wakefield Chamber of Commerce is, and the Wakefield Co-op banks. And they're free. So show your support for keeping Wakefield healthy.
That's great. That's a great initiative. And because Wakefield has some great connections through our town council chair, we are going to have Santa Claus here on the 12th. He's not going to touch you. He's not going to stop. He will be doing a little bit of a car parade through the downtown. So not through the downtown, through the neighborhoods. Go on our website and see the route for he and a couple of reindeer cars, and they will wave to you, and you can have your young kids wave to Santa, a lot like we did for the graduation for the high school kids. So it's not going to be a mass of people. Check the route, find a little spot where you and your family can stand there, and hopefully the young kids can wave and see Santa. It's a long route. There's plenty of spots for people to socially distance, and there'll be no stopping, no candies or anything like that. Coupled with that, we would like that we want to think about people that are a little bit less fortunate that a lot of us are. We will be collecting Toys for Tots along the route. If you can't make it that day, and this is at 1 o'clock, by the way, on the 12th. Can't make it that day, the police station, you can bring an unwrapped toy there, and it will make a young person and their adult caregivers happy that something would be there under the tree for them this year. So other than that, again, thank you to all of our town workers, and thank you to the citizens for all your support. We get a lot of calls here at Town Hall, people saying, listen, thank you for all the work we're doing. And hey, we're trying, we're in this with you. And I get it. We're down to 3 fishes this year instead of 7 for our Christmas Eve deal. No, we'll still have 7, but we'll have much less people. So take care. Are there any other final words of wisdom, anybody? No? All right. Have a great week. Stay safe, everybody. And we'll see you next Friday. Thank you. Bye-bye.
Thank you.
Thank you. Bye.